Hi, welcome to the COVID-19 Awareness and Prevention presentation. This presentation was developed by Connie Marmolejo and myself, Marisol Torres. Both are health educators at The Well. The point of this presentation is really to understand your commitment as peers in educating and on preventing COVID-19. Also, just get some general information about COVID-19 and then how to support your community, whether it is your peer group or the UCR campus in general. Why should peers be committed to educate on prevent COVID-19? That's an easy question. As peers, you are leaders in this campus, and whether you're on campus or not, students see you as leaders and want to make sure during this pandemic, during this crisis, that you have some general knowledge on COVID-19 that you can share with students if needed, and also that you show your commitment to them, and whether you're on campus or not, that's really important. And also keep in mind that as student orgs or student groups, there are certain commitments that are required that UCR is asking, for example, to not hold any in-person meetings or in-person events, and really to kind of hold on to this motto of keeping Highlanders healthy. We want to make sure that Highlanders are healthy in every way possible, and especially now with COVID-19. Lastly, it's important to remember that this is important because anyone can get COVID-19, including you. So we want to make sure that you consider the people you work with, the people you live with, the people who reside in your area, and even those you might not even come in contact with, and especially those who are at higher risk for COVID-19. This is also a health equity issue. We know that COVID-19 affects certain groups more than others, and so when you commit yourself to learn and to practice, good behaviors when it comes to COVID-19, you're also committing yourself to health equity. And lastly, it's important to know that most confirmed cases of COVID-19 in Riverside County, but honestly, we see this all around, is between 18 to 39-year-olds, which is right around the age of college and college students. So again, this is why it's really important for you as peers to know this information. First, learn a little bit about virus terminology. These are three terms that you might have heard often, and you want to make sure you know what each of them means. So incubation period is the time between exposure to an infection and the appearance of the first symptom. So when someone is exposed to a virus, they don't necessarily feel sick right away. It can take days or even weeks. In the case of COVID-19, it takes anywhere from 2 to 14 days for someone to feel symptoms. What we also hear is something called pre-symptomatic. So that's during the incubation period. When someone isn't showing symptoms yet, that means they're pre-symptomatic. They don't feel sick yet, but they do have the virus and they can still spread it to others. Asymptomatic is a little different in the sense that, yes, they're still not feeling symptoms, but these people will not develop symptoms at all. Often we see these with young people. So a person might never actually have felt sick, and yet they could have still had COVID-19 and still spread it to others. So how does COVID-19 spread? I'm sure you all have heard this. We want to make sure that it is very clear that mostly it's spread through the release of droplets. So that's when someone maybe sneezes or coughs or even talks or sings. Every time we do any of these things, we are releasing droplets. It might not even be visible to us, but these droplets can have the virus. If someone is sick with it and has the virus within them, then those droplets contain it and then can pass on to someone else. So that means it can pass on to someone even if they're not in close physical contact, but that's also why we ask people to keep 6 feet distance at minimum. It can pass person to person to close contact, like hugging, kissing, shaking hands. Again, if you're that close to someone and they have the virus and it's active, it can be spread. Or if they, have sneezed in their hands and then you shake their hands and then you touch your face. And then one of the other ways too is it can land on surfaces, being left on objects like doorknobs, utensils, laptops, things like that. And so if it's there and somebody touches it right after and then they touch their self and their face, again, it can be transmitted that way. And remember, as we saw on the last slide, it can spread even if a person has no symptoms. How to prevent COVID-19. Wash your hands. We'll go over the steps on how to do that. Wear a mask and make sure it fits properly and it covers your nose and your mouth. Cover your cough and sneezes with the inside of your elbow, so don't sneeze on your hands and don't let it just be free without any cover. Avoid touching your face, eyes, nose, and mouth unless you have washed your hands. Maintain at least 6 feet. And remember that a face covering does not substitute for social distancing. So you need to have both, right? You need to wear a mask and keep 6 feet away from people. Avoid large gatherings and keep your distance. And then clean and disinfect frequently touched surfaces like doorknobs, steering wheels, cell phones, and credit cards. One easy way to remember this is think of face, hands, and feet. Face, cover your face. Hands, wash your hands and feet. Keep yourself at a distance from others, not in your household. So with hands, I know we probably all learned this when we were young, but it's always a good reminder to wet your hands with clean running water, lather with soap. Make sure you do the back of your hands, between your fingers, under your nails. Scrub your hands for at least 20 seconds. Rinse your hands, and then dry your hands, preferably with a paper towel or air dry them. Remember that washing your hands is actually better than using hand sanitizer. So if there is no water or soap available, then use hand sanitizer. But if there is soap and water available, wash your hands instead. The flu versus COVID-19. In the beginning, there was a lot of confusion between the flu and COVID-19. So we want to make sure people understand the difference. And also because flu season is probably right around the corner, and so we want to make sure people understand and are prepared. So the flu has an incubation period of 2 days, whereas COVID-19 has an incubation period of 2 to 14 days, which means, again, a person who has the flu can feel sick within 2 days, and they will be able to know. Someone with COVID-19 can take up to 14 days. So again, there's a more possibility of them spreading without knowing. You are able to get a shot for the flu, and in fact, for UCR students and staff, they will be required to get the flu shot, really to prevent what is sometimes referred to as a twindemic. So the flu already causes often several deaths and makes it difficult for students to study and you know, to get through their days. But on top of that, if we have COVID-19 happening, then you can just imagine that this intensifies. So now there'll be a lot more people getting sick, a lot more people in the hospitals, a lot more people not being able to do simple things because they're feeling sick. Also, keep in mind that a person can have the flu and COVID-19 at the same time. So that's why it's important to get the flu shot. There is currently no shot or immunization for COVID-19 as this was recorded, but there is one for the flu. Some people can be immune to the flu due to having the shot or already having the flu in the past. There are oftentimes we hear people who say, well, I never take the flu shot and I never get the flu. And so they just decide they don't need the flu shot or the flu shot doesn't work. The reason sometimes why people don't get sick, even if they didn't have the flu shot, could actually be because a lot of people around them did. So that's what we call herd immunity. If many people are taking the flu shot, then it's less likely that other people will get it themselves. So don't just assume that you don't get the flu. Maybe you didn't get the flu because everyone else took the flu shot. And then also, some people might be naturally immune to it, but not to COVID-19. This is new to our bodies. We're not naturally immune to it. So it's really important to keep that in mind. Only 2% of people need to be hospitalized from the flu, whereas we have seen sometimes 20 to 31% of people with COVID-19 who might need to be hospitalized. So it is more serious. Now, if you or a household member have been exposed to COVID-19 or think you have been exposed, here are 2 things to consider and also 2 terms to learn. So isolate if you are sick. So isolation is if you are actually feeling sick, then you want to separate yourself from people who are not sick. Stay home for at least 10 days since the symptoms appear, and at least 24 hours without a fever and symptoms have improved. If you live with others and you're able to, it's important to have a sick room where the person who is sick lives and sleeps and eats, so that others aren't exposed. We know that that might be difficult in some households, but if available, you can do that. And then quarantine if you may be sick or you thought you might be in contact with someone. So maybe you're not feeling sick, but you know you were in contact with someone who was, or someone who tested positive. We still recommend people to separate and restrict their movement if they're exposed, and stay home for 14 days, just in case. So these are recommendations from the CDC. And again, you can find these through the CDC website, or also contact your doctor or student health services if you think you might be sick or have been in contact with someone, to know what to do. So again, who to contact. If you have a fever, cough, or other symptoms, or just feel sick, we recommend you stay home. If needed, seek medical attention, student health services, or your healthcare provider. If you do have UC-SHIP or G-SHIP, Student Health Services is open and available by appointment Monday through Friday, and they're doing telehealth and phone appointments available, and there's also 24-hour nurse line. Even if you're not on campus or and would like to make an appointment in person with someone, if you have UC-SHIP or G-SHIP, there's still ways to do it even if you're not on campus. So make sure you check with them. And then if you are working on campus or you're coming to class on campus, please notify your instructors or employers if you're going to miss class or work because of this. Testing. So there's free testing sites, state or county testing sites all around the state. No insurance is required. They may ask for insurance just so they can bill them, but it won't cost you anything. But if you don't have insurance, that's fine. You don't need to have it. They also do not ask for Social Security number, so you don't have to be afraid of getting tested. And if they do ask for Social Security number, which they shouldn't, then it might not be the right place for you to be at, and do not provide that information to anybody. Testing at UCR, it will be happening soon and actually has started. And this is mostly for students who are living on campus. So if you are living on campus in the rest halls, you will get more information about that. Other things to consider is UCR has a wellness tracker. So for students who are going to be working on campus or will be taking classes on campus, they will do this wellness tracker before coming to campus to make sure they're okay and to get certification to come to campus. Again, if you are going to be on campus, you will get this information from your supervisor or your professor. And then there's also the COVID-19 student training module coming soon, if it's not already. And this module is a short 15-minute module similar to this, but a little different, that really provides more information on COVID-19 for students to know, especially for those students who will be on campus. And as always, we recommend going to the UCR coronavirus website that you see here, ehs.ucr.edu/coronavirus. So this is where you'll find most up-to-date information. So what is the WELL doing? So the WELL is doing COVID-19 wellness kits. So these kits include a lot of different things, from hand sanitizer to face coverings to sleep kits, condoms. So things that the WELL would typically provide, and also things that are more specifically to COVID-19. A lot of these items were donated from generous partners on campus, and we're very glad that for these amazing partners. The WELL also is doing a well-being survey for their student staff, so that every week we can check on them and see if there's any specific needs that they might have. So for example, maybe they are feeling sick, or maybe they need a thermometer, maybe they want to know more about how to apply for CalFresh or things like that. Some other campuses have actually implemented our well-being survey, and so you might be doing one yourself. And then lastly, we're also doing requested programs. So we've always done requested programs. Now they'll be virtual, but they also are requested programs specifically with information on COVID-19. So things that we typically talk about, like mental health, but now how do we think about mental health, especially during COVID-19? Things like sexual health in COVID-19, safely partying in COVID-19. So you can always request for us to come speak to your peers regarding things regarding health and well-being, and all the topics we typically cover with a little spin on COVID-19. And that's all. Thank you all for watching this. And again, if you want more information on what the Well is offering regarding those services, feel free to contact us. Check our website. Also follow us at the Well UCR on Instagram, where we have most up-to-date information. Thank you.